Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Today I shall be speaking on knowledge and prevention of lung cancer. This happens to be my experience recently, losing a close church member, and it's really saddening my heart. But uh, we need to learn how to prevent cancer generally, or if possibly what and what knowledge we need to have in order to be above some of the mistakes that could bring about this cancer. Yes, cancer is a problem that has been regarded as something cosmic in the past, many years ago, as if the causes could not be found. But now, it has been traced to genetic, more or less, problem. It is gradually moving from genetic to epigenetic. When we talk of genetic, it means it is in your system, it is in you as a member of a family. But we have found out that people who belong to these various families don't get these cancers until after probably a long while, and that explains the epigenetic aspect of it, when the body has the lifestyle has now affected the gene and mutated the gene, making the gene come alive. So it's more or less transformed that gene to something, a mutated gene that will now cause this cancer. With lung cancers, you have things like smokers. There are smokers who have not come down with lung cancers, and there are people who never smoked but have come down with lung cancers. The smokers that never had lung cancers exposes us to the fact that there are certain things in their body that prevents that the genetic mutation that will cause lung cancer. But those who don't have probably live in that environment. That is what we mean by epigenetics. Both the internal or external environment could affect the mutation and make them become patients of lung cancers. So, but this is not detailed enough. Let us go into the slide session where I shall expose more how to prevent, possibly how to prevent lung cancer. So if you like my presentation, press the like button, subscribe, and more facts will come your way. The outline, objective, introduction, prevalence rates, lab diagnosis, prevention, and maybe mention of treatment is all that I shall be talking about in this video. The objective, to expose the predisposing factors of lung cancer, laboratory diagnosis and prevention in order to reduce its prevalence. Introduction. The lungs are one of the vital organs of our body. As could be seen in the diagram, lungs are two sponge-like organs in our chest that are separated into sections called lobes. The right lung has 3 lobes and the left has 2 because of the space meant for the heart fittings. The main function of the lung is to inhale oxygen and exhale carbon dioxide through the alveoli, even shown in the this diagram that you see. After the bronchiole, you got the bronchiole as well as the alveoli. The alveoli is where the oxygen and carbon dioxide exchange with the capillaries. Lung cancer starts in the cell of the lungs and are named according to the cell affected. Lung adenocarcinoma starts in cells in the lungs that make mucus, called epithelial cells. The surface of all the organs, usually organs are made up of cells and tissues, and then because there are so many different types of cell and tissue, that's why it is called an organ. And so when the cancer will start, it starts with one local area as depicted as shown in that diagram, and then from there it starts spreading, and that is what you see as cancer. Yeah, lung cancers could be grouped into non-small cells lung cancer and small cell lung cancer. The non-small cells cancer is about 80 to 85% of the lung cancers that we see. The main subtype of non-cell cancer, lung cancer, are adenocarcinoma, squamous cell and carcinoma, and large cell carcinoma. So you can see the picture as shown, and about 10 to 15% of lung cancers are the small cells lung cancers. Lung cancers is the leading cause of cancer death in the United States. Early symptoms of lung cancer can be subtle, but the sooner it is diagnosed, the better your treatment, optional and possible outcomes. I have just said the majority of all these surface, the epithelial cells, both the main one, the adenocarcinoma, is caused by these smoking cigarettes. The prevalence rate. According to WHO, lung cancer is the most common cancer type and the most common cause of cancer death in the world. In 2022, almost 2.5 million people were diagnosed with lung cancer, and more than 1.8 million people died from the disease. It shows that it's very deadly. Lung cancer causes more than twice as many deaths as colorectal cancer, which is the second most common cause of cancer death. The enormous burden of lung cancer obscures the fact that most cases are avoidable. The principal risk factor for developing lung cancer remains tobacco smoking, which is responsible for approximately 85% of all. Other common causes include exposure to contaminated such as secondhand tobacco smoke, polluted air, and asbestos. The laboratory is very useful for screening tests to detect whether any of the stages are stage 0, 1, 2, 3, 4. The size of the tumor is indicative of the stage, as well as if it has spread to the lymph node or to the thorax or other adjoining organs, the metastasize. Sputum cytology and lung needle biopsy is done on the tumor cells that are collected to know whether they are cancerous. The doctor can also perform bronchoscopy, and then thoracensis is the fluid. If there is fluid in the lung, is examined to see if the cancer has spread there. There are other image tests that are done that are also very useful, very good, including the MRIs. So many tests could be done to really detect the stage at which the lungs is. Finally, prevention. Smoking is the single biggest risk factor for lung cancer. Like we will have to know what are the risk factors. It's these risk factors that you try to prevent. These include cigarettes, cigar, and pipes. Tobacco products contain thousands of toxic substances that are carcinogens. According to the Center for Disease Control and Prevention, trusted source, cigarette smokers are 15 to 30 times more likely to get lung cancers than non-smokers. Second-hand smoke, that is those who are in the area, the environment where there is too much smoke, also increases their risk of lung cancers. Radon, a radioactive substance that is found even in the areas where there is this oil, crude oil, and all this extraction. Exposure to radon is the second leading cause of lung cancer, according to the American Lung Association. Breathing in other hazardous substances such as asbestos, arsenic, cadmium, chromium, nickel, some petroleum products like and uranium are things that could lead to lung cancers. Yeah, without much ado, prevention is more about avoiding, because even a family history of lung cancer or previous radiation therapy to the chest, these are things that could cause this lung cancer. So it's how to avoid all these things. So to prevent lung cancer, don't smoke or quit smoking. Avoid random. You can have your home tested for random to help reduce your exposure and lung cancer risk. We can also eat vegetables and fruits. These are things that are antioxidants and could help remove the damages done to the genes. Regular screening is also very useful for people who have it in their family. According to the American Cancer Society, avoid carcinogen in your environment. They cause gene mutation that may eventually lead to lung cancers. And when the treatment is usually by chemotherapy and radiation, there are other drugs that are used to remove the mucus and reduce the pains. So the story is that of pains, and we pray that the solution will soon be found, where people, but for very good prognosis, early detection at stage 0 or 1 is very necessary, so that it is at that stage that is the prognosis for curing it is very high. If you like my presentations, just watch more videos and subscribe. Thank you.